Very good morning to all. It depends upon the time constraint. We'll follow with the clinical procedures. Before that, we'll see a little bit about fluid therapy. Hope there was enough fluid therapy yesterday. Some have enjoyed, and some have, as a spectator, have enjoyed. That is a critical part for relaxation. Okay, so fluid therapy in bioelectric practice. Fluid therapy is the hallmark or the boon for any vet or a human to interact with the client or the patients. So we want to deliver the drug or the electrolyte, it is only through the fluid therapy. So that way, this is an important, and any practitioner cannot miss this. And it should be precise, and the quantity and the dose should be precise to save the life of the animal. So this is the theoretical, just to know how many liters of fluid is required by the animal. Any standard book or NRC gives about that, just an eye opener. So normally we give a fluid therapy at the rate of 10 to 20 ml per kg body weight. If it is in a shock, so you can go up to 90 ml. With the materials available with us, we are not able to reach even 40 ml per kg per hour, right? Because the IV set is so that you cannot reach that amount. So that is the limit, but you can go safely with 40 to 50 ml per kg per hour. That is the shock dose. That is the rate. So you can give even up to that, nothing happens. So you, as the practitioner, you all accept with me the standard IV set available with us, and maybe a 500 ml or 1 liter sachet is available. Normally it takes to 5 to 6 minutes, correct? Maybe a little bit lower than that when you are going to use a higher gauge needle. But when you want to deliver the exact required quantity of a fluid, maybe 7 liters, sometimes 10 liters, we normally give 12 to 15 liters depending upon the case in our institute. So this occupies, so maybe if it is 14 sachets, 14 into 5 minutes, you spend 15 minutes or half an hour for maybe examination, the animal history, analyze, and then think a while and come to a diagnosis and start treating and give this. This takes a big amount of vet. Occupying is valuable time. Already he gets a call that another cattle is waiting. The diagnosis is correct, the choosing of the fluid is correct, but the time is restricting or preventing the vet to deliver the fluid. So we get carried maybe 2 sachets or 4 sachets, and even the client believes this is the quantity that animal should receive. And he gets 4 sachets. 4 sachets is the limit. And because of the time constraint, or put heavily on the vet, so he goes out. And again he has to repeat. So how much to be fluid to be given or delivered to the animal, we'll see in subsequent slides. So to overcome that, we have got a rapid intravenous fluid administration set. This is a set, and this we have been using it, and many vets are using, and now it has crossed Tamil Nadu, and all the vets in North India also started using that. What is the beauty of it? Beauty of it, it delivers 500 ml in 90 seconds. So shortens, you may ask whether it will go for pulmonary edema. That's why I said even 60 ml per kg per hour, we are not able to reach. So over and above that, 45 is safe. Now even 45 we are not able to reach. So with the available gadget, we are able to reach 30 ml per kg per hour. We are well within the limit, and it is not going to cause edema. At the required quantity of fluid can be delivered. How much is to be delivered, we will see in the slide. We are not crossing the limit. The quantity of fluid, whatever you have calculated, has to be dealt only through the component called plasma. You cannot directly enter into the intracellular cells or interstitial cells. That we will see. So this is available. The cost is very cheap, maybe 500 or 500 plus. So the decided quantity of fluid can be given, and you need not visit the animal again. So there the science and ethics comes. So you can see we got 2 boxes, 24 like that, and the required quantity is being delivered. Time is, what is the time constraint is being relieved. For samples I have brought it here. Those who are feel that the time is the constraint, that I am not able to deliver the drug or the fluid, they can make use of this. Next slide, I am taking you to one path. So please watch this video carefully. A needle is being introduced. Through the needle, a wire is passed. This is called through the needle. A wire is passed. Now once we are confident that wire is sufficiently seated, we are going to take the needle out. The needle will be taken out. The wire will be in the jugular vein. Okay. That is the sheath which holds the wire. Now wire is there, holding the skin, removing the needle. This is J wire is still in the jugular vein. Now somebody holds it so that now we take the catheter, what is called we call it a venflon or the catheter. The catheter is passed through the needle, the wire, and simply passed just by finger movement, gentle. Everywhere is gentle. So what wire has been into the jugular vein, we are threading into the catheter. Okay, hold the wire, J wire, so that it does not slip by accident into the jugular vein, and then pass it gently into the jugular vein. Hardly it takes 2.5 minutes. This is we called as a long cap or intravenous catheter. This can be used in cattle. We have been using it. Then you can put a stay switcher, that everyone knows, a stay switcher, and put an adhesive tape. Then your jugular vein is there with you for 5 to 6 days. You can ask, I can use venflon? Yes, you can use venflon, but if you fix it like that, when the animal turns like this, venflon comes out, which we have experienced in many cases. Maybe for a short period. Venflon is designed for pediatrics, human, like that. We have extrapolated and used in dogs, of course, but not in large animals. So once if you keep it like that, it turns like that, it comes out. So you are not there to take care. So what is this purpose? The catheter is fixed. Is it audible? When it comes too closer, there is echo, that's why. So this is the procedure. Just I'll put it in what is that is being done in a fraction of next slides. Why this is being done? The catheter is there. Previously we have got a needle, 14 gauge needle. Just by insert it goes smooth, very smooth. Even the first beginner can introduce the needle, but when it shakes, there is a severe bleeding. To overcome this, we have given this catheter. Now you can ask, what is the cost of the catheter? The cost of the catheter is 2,500 rupees. How we can afford? We can afford. We have by trial and error, we have chosen the catheter available in the field. The catheter cost you about 130 rupees. Another J wire, we have got only two components. One is the needle, which is already with us. The needle is already with us. Maybe you can get it, needle, 18 gauge or 16 gauge needle. Then this catheter is 130 rupees. The J wire, which is 40 rupees. Do this, put a stay switcher, flux it, whatever amount of fluid you can give. Go have a visit to the second, dislocate, finish off, and then come back. You are with the persons, with the animal. No shaking, nothing. We have done even in colic horses. You know how colic bad is. It jumps, rotates. It is there. Whatever does magic it does, the catheter is there. So this is what I want to stress. This is very simple, easy. What has been a restriction, frequent moving and holding the needle, or restraining the animal. You know, we are single-handed. Most of the time, a senior old lady is there or woman is there, not able to restrain. However strong he is, even if strong, he can restrain only for half an hour. The fluid goes for 1.5 hours. It's very difficult. So this restraining only for 5 minutes, put the catheter. All things are free. You are free. He can do other things, loading, pack the things, and then do other things. And the communication gap, I told, what needs to be communicated to the owner can be communicated in a proper language. So all this time constraint has been relieved by this catheter. Okay, we have been selecting the catheters trial and error, and at last we got this. I have brought the catheter here also. If you find it difficult in purchasing, you can just address to us, any of the institutes. We will we'll procure and then give it to you. So this is very easy. When you're going to get it in less numbers, 5 or 3, it may be costly. When you get it in bulk, maybe this lava, you have got already we have got a friendship or association. You can bulk, get it in groups of maybe a district wise. It is cheap and our purpose is solved. Okay, that way. Now to more go into deep into sulci, I explain the components. This is the needle and previous one is the, this is the needle and this is the dilator. Certain cases, the skin is so thick, we have done a needle, J-wire and then catheter. Okay, so if it is very thick, subcutaneous thick is very thick, okay, we need to use a French dilator. We will see the sequence. Now I am labeling it needle, French dilator. This is the J-wire. Why it is J-wire? The tip is in the form of J. Why it should be J? This is because of the invention. If it is a straight wire, it goes, pierces through and through the intima, goes through the jugular vein outside. You may think it is in the vein, but it goes through and through. That is the invention. It is a J-wire. As long as it is in the sheath, it is straight. When it comes out or into the jugular vein, it has the J-wire. So that way it is protected. So you know this is, I am putting in a dog because the dog had some time to take a video. In cattle I do not have time because single-handed. So that's why explaining in case of dog. So put the hypodermic needle in the jugular vein. Needle, presence of blood, flash of blood indicates is in the jugular vein. Okay, now passing the J-wire just by sliding action, all by gentle. Pass it gently, it goes into the jugular vein. To have a recap and explain it, which we are not able to see it in horse. The first slide was in horse. Just by sliding you do it. Just for the purpose of photography I put like that, otherwise you can do it with your thumb. As you do with the thumb, it smoothly goes inside. All by single-handed. Because we are single-handed at field. Just put the needle and then push it, it goes within 10 seconds. Take out the sheath, wire is there. Now you can appreciate the wire is there and needle is there. Now we are going to remove that. Okay, then in case if there is a problem of thick subcutaneous tissue, then use the French dilator. Sorry. Sometimes so use the French dilator, use to and fro movement, it goes inside. Like that also in force. The case of cattle. You do not have difficulty in case of buffaloes, horses or cows. Maybe a cattle which is maybe 4 or 5 calvings, you have then you pass this, again you take it out the French dilator. The wire will be always there. At the end only, you have to put the catheter, take out the wire. Once you take the wire, the blood will come. Either you collect the blood for your analysis and then start your fluid therapy, then put a secure with a stay suture, adhesive tape, you are safe. So this is a simple procedure. If we follow it, we have been doing it for decades. We got a good result because we can keep on attempting these cases. Please follow it up. So that is what we are doing. A recap, pass the needle. Okay, coming on to the ketosis. Our primary aim is to bring back the animal to normal. Use D20, isoflurane or insulin, this which we have discussed yesterday. The problem with this, you go there, treat the animals, and the animal becomes apparently normal, and you get satisfied. But the problem is the animal goes for recumbency. Animal goes for recumbency. It is because of drives out potassium. Potassium is important for its musculoskeletal. So it becomes recurrent. So it becomes, you may think it is some other thing, maybe hypocalcemia, give calcium, make it worse. So always take care. Potassium is more important, double-edged sword. So since you are treating it with D20, isoflurane will make hypokalemia. So if you are treating for ketosis, selecting isoflurane, tell the owner, sometimes maad padudunga ena koopudunga idu solittu vandunu ella maatukku varnanu avasiyam illa doctor sonnar maad paduduchu koopudunga direct potassium treat pannilla sollalina ivar vandaru seri avale vera doctor koopar அவர் வந்து டோட்டலி இது மில்க் ஃபீவர், கால்சியம், மெக்னீஷியம் எல்லாம் போட்டு திருப்பி அது படுத்துட்டார். என்ன டெஃபிஷியன்சி இஸ் பொட்டாசியம். ஸோ இது ஜஸ்ட் வேர்ட், தட் இஸ் வேர் கம்யூனிகேஷன் மோர். சில மாடு கொஞ்சம் படுத்துக்குங்க, அதுக்கு கொஞ்சம் நீங்கள் கூப்பிட்டீங்கன்னா நான் வந்து பார்த்தேன். So in that case you give potassium. So the worst case, these many of our vets would have seen. Many vets would have seen this. That is because hypochondria, S-shaped neck. S-shaped neck நிறைய பேர் பார்த்துருப்பீங்க. அது வந்து 4 பேர் போட்டு இழுக்கிறது, இந்த பக்கம் இழுக்கிறது, அந்த பக்கம் இழுக்கிறது, அது வளையாது. It's because of the muscular contraction on one side. It is like that. So best treatment is potassium, and you have to give very slowly. Okay, that is this one, S-shaped neck. Unless you give potassium, அது அப்படியே தான் இருக்கும், அப்புறம் கல்லிங் தான் போடணும். So give potassium. Don't give potassium as fast as you can like other electrolytes. கால்சியத்தோட ஸ்லோவாக கொடுக்கணும். 3 ampule available. Ampule, it is available in 10 ml. Give 10 ml ampule, not more than 3 ampules in a 500 ml sachets. So you may require about 17 to 20 ampules. கொஞ்சம் பேஷன்ஸ் வேணும். அது இந்த கத்தீட்டர் போட்டு கொடுத்துட்டு மேபி யுவர் doctors or whatever you have, அவங்ககிட்ட கொடுத்து அடுத்த டிஸ்டோகே போயிடும். ஸோ you don't exceed 0.5 milliequivalent or 1 milliequivalent. போச்சுன்னா கால்சியம் மாதிரி இறந்துடும். Suppose you have a facility to estimate what is the potassium available in the serum, then it will give you how much milliequivalent to dilute. This is very complicated. So I hate math, that's why some to come to science திருப்பி மேக்ஸ் போட வைக்காதீங்க. So that I understand. Yes. This is called a Scott's sliding scale rule, what we use in man and dog. Assess this concentration based on the serum, then this will tell you how many milliequivalent of potassium to add to every 500 ml. Then what is the speed? Because if we are going to exceed this, animal will kick the bucket. So just like calcium. So this is a Scott's sliding rule which they use in human and dog as well as in cattle. This can be used if you have a facilities. Otherwise you use that not more than 3 ampules per 500 ml is the best. You will see the animal lying down, and then after this fluid therapy animal gets back and walks home. So that is the hypokalemia. Then this is one important thing is we give dextrose. Having calculated so much amount of fluids, pump in dextrose. The property of dextrose is drive away the phosphorus. So you always take into mind, whenever I give dextrose, I should give phosphorus. Okay, so phosphorus injection has to be given. Now don't think of 30 ml, think of 60 ml. Okay, because it dries away. Our aim is to treat the ketosis. So the property is to drive away. But anything, you need a phosphorus. It drives away, so it needs to give. Okay, that is the important of this one. This acidosis already they are discussed, but important take-home lesson is this one I want to concentrate. So there are this ready-made blood gas analyzer which is available in institute, big institute which cost about 16 to 18 lakhs, which we cannot afford. And what is available portable is 1.5 to 2 lakhs with a cartridge of 300 rupees. For every animal you have to put a cartridge of 300 and get this. It's a bedside. But again, cost constraint. So you use this. There is a score, and what is the base deficit? 1, 2, 3, 4. Easy. 1, 2, 3. No need to any mug up anything. So this is the score. 1, 2, 3, and immediately electrolyte. What is it stands for? Standing good. This is how the animal is. This is the D-mean score, which helps us to identify the deficit. So there are 2 categories. One is less than 8 days. This is the newborn or neonates. This is slightly above. And both are pediatrics only. This is a D-man score. Identify that. That will give you the deficit. This is more important. Okay, if you substitute that, the animal will become normal. More scientific. So this is how you do it in the case of pediatrics. For all our pediatrics, this is the score. So you identify the score, it's very easy. You have to, it is again for our understanding, it is also easy. 0, 5, 10, right? And 5, 10, 15, 20. No complications. It's easy to remember, and that is how it is by trial and it is being set. Or if still have a confusion, remember this as a one thumb rule. Less than 1 week, more than 1 week, this is the rule. If more precise, the previous slide. If still I cannot remember more, you take this in your WhatsApp, keep it in a screenshot, and then that you refer and then start giving this. So this is the deficit in case of pediatrics which you need to give as explained. இது எல்லாருக்குமே தெரியும். Capillary refill time, press the gum and take it out with a thumb, or then assess the color becomes blanched. The time taken for the blanched mucous membrane to reassess, to regain the original color is the capillary refill. அது எல்லாருக்கும் தெரியும். This I have been telling in many CVE or many things, maybe for many of you maybe repetition. But என்ன ஆகுதுன்னா இது வந்து அப்படியே போய் என்னன்னே தெரியாம போயிடுது. Especially when youngsters come to our clinic பண்ணும்போது தெரியல. அது என்ன அப்படின்னா press the gum எப்படி கவுண்ட் பண்றது? இப்படி பண்ணா அதுக்குள்ள 1 செகண்ட் போயிடும். உங்களுக்கு தெரியல, கண்ணிமைக்கும் அது அப்படிதானே, ஒரு வினாடி அப்படி சொல்றேன். அப்படிக்குள்ள ஒன்று போயிடுதே. உடனே இது அவர் யங்ஸ்டர்ஸ் ஆர் வெரி இன்டெலிஜென்ட். ஏன்னா ஸ்மார்ட் ஃபோனுடைய இன்டெலிஜென்ஸ். நான் வேகமாக பார்த்துருவோம் சார் அப்படின்னு சொல்ல, எப்படிப்பா இல்லை சார் நான் ஸ்மார்ட் ஃபோனு அண்ட் தென் ஸ்போர்ட்ஸ் வாட்ச் யூஸ் பண்ணேன் அப்படின்னு சொல்லுவாங்க. ஸ்போர்ட்ஸ் வாட்ச் தெரியுங்களா, டிஜிட்டல் இருக்கும். 1 செகண்டுக்கு திருப்பி ஒரு 50 ஃப்ராக்ஷன் செகண்ட் இருக்கும், அதுக்கு ஒரு 60 ஃப்ராக்ஷன் செகண்ட் இருக்கும். அதை வச்சு பார்த்துப்பேன் சார். எல்லா இடத்துக்கும் வராது, பேட்டரி போச்சுன்னா கோயிந்தா இல்லை. Whatever need is more scientific. Whenever you say science, repetition is more, repeatability is more important. And whether you are here or in UK or any Kontalampatti, it is the same. So how it is the science? இது வந்து நம்ம கிளாஸ்ல நம்ம வாத்தியாருங்க சொல்லி கொடுத்தாங்க, ஆனால் மறந்துட்டோம். அது என்ன பார்ப்போம். ஸோ வாட் ஹேப்பன்ஸ், நான் வேகமாக பார்ப்பேன்னு சொன்னார்ல அவர் ஜென்டில்மேன், வேகமாக இப்படி பார்த்தாருன்னு வச்சுங்களேன், ஒரு 5 கேஸ் பார்த்தாருன்னா அவர் அப்போலோவில் he will be in critical care for acute spondylitisக்கு ட்ரீட் பண்ணியிருப்பாரு. அங்கே இன்னொரு ஸ்டூடெண்ட் இருக்கான்ல, 3rd year MBBS, அவரு சிஆர்டி பார்த்துட்டு இருப்பார். அவர் சரியா பார்க்குறாரா இல்லைன்னு தெரியாது, அது அவங்களுடைய டீச்சர் எப்படி சொல்லி கொடுக்குறாங்கன்றது பார்க்கல. டு ரீஎம்பசைஸ், மேபி இட் மேபி லுக் வெரி 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 சிம்பிள் ஆர் பேசிக், பட் இது வந்து கட்டாயம். நாட் ஓன்லி ஃபார் சிஆர்டி, ஃபார் வெரி தி திங்ஸ் விச் வி ஆர் கோயிங் டு சி ஃபார் ஃப்ளூயிட் தெரப்பி. எப்படி கவுண்ட் பண்ணுன்றது முக்கியம். அது கரெக்டாக நம்ம டீச்சர்ஸ் சொல்லி கொடுத்தாங்க. சில டைமில் நம்ம ராக்கெட் விடும்போது மறந்துட்டோம். ஸோ இது வந்து ஜஸ்ட் யூ கேன் see this. So what you are supposed to do is, you press the gum, release it, continue to see the gum and then count it. How to do the counting? Counting is you just count like this, 1001. Continue, press, then release it, continue to see the gum only, and count it as 1001, 1002, 1003 and 1004. The time at which the color regains is the CRT. That is the second. Whether you take it for CRT or whether you take it for skin tint test, this is the things. It is solli kudutanga na marandhachu. Some different people take it in different way. For example, if you take it in Kerala, they take it as 1 elephant, 2 elephant, 3 elephant. So you can ask, I can take it as a 101, 102. 101 la avlo varadu. 1001 da or second one. So you can say 101, 102 வேகமா கவுண்ட் பண்ணுவேன். 10, 10, 1, 12, 11, 12, 13. So that is why it is being standardized and kept like this. This is universal. 1001 is universal. So even if you go to states and then count, this is the second. If I say 3 seconds, somebody else, a beginner also should have a 3 seconds. So that way it applies for capillary refill time and also for any skin test. எதுக்கு திருப்பி சொல்றேன்னா இது முக்கியம். இப்போ நம்ம பார்க்க போற ஸ்லைடு is more important. So assessment of dehydration, this is available in any standard textbook, or when you browse it, this is what is going to give. First column is the percentage of dehydration, second column is the clinical signs. So what is percentage of dehydration நமக்கு தெரியாது, we are going to assess, and what is available on the right side is the clinical signs. Market, இதெல்லாம் self-explanatory, all these are self-explanatory, are available in any standard book. I am not the author of this. So you see the clinical sign and attribute the percentage of dehydration. So why it is needed? It is needed for fluid therapy. And the next part is the 10 to 12 and worst is 12 to 15%. Again, these are the clinical signs. இது எதுக்கு அப்படி பார்த்தோன்னா இந்த சிஆர்டிலாம் இங்கே வருது. சிஆர்டி, ட்ரை மியூக்கஸ் மெம்பரேன், என்ன பண்ணுறது. If the CRT is not there, then that is not there. Skin test. This is scorecard which you need to mug it up or remember. Okay, so this I request you to remember, because pediatrics you are not supposed to lose the cough or because of future if. So pediatrics, again the skin test. So the dehydration which we have seen in the previous slide is for the adult, Now this we are seeing for the calves. Calves, the skin test is more important. Again, skin test counting is 1001, 1002. So this is important, which we need to identify where exactly it falls. And regarding the eyeball, how much the eyeball has recessed or gone deep. Exophthalmos is protruding. Enophthalmos is going in. So how much it goes deep, that it is given. So this is very, very bad. It needs immediate attention of fluids. So this way, this is more important. Please take it to assess the quantity of fluid deficit and need to administer. This chart also, please remember, this is more easy to remember 0 to 468 in multiples of 2, dehydration, identifying it, and then eyeball recession, and then skin test. Okay, so this is easy. Previous one, a cut short one, and this is in 0 to 4, 6, 8, 12 to understand this, to identify what amount of fluid. Our aim is to identify the dehydration. What is the percentage of dehydration? Once you know the percentage of dehydration, calculating the fluid therapy is very easy. So this is important. The take-home lessons are only 2: capillary refill time, how to assess, and the skin recession or the eyeball recession is important. And coming this fluid distribution, which we have already know in physiology long back with and forgot also, don't bother about that. Now you remember 60% is the water of the whole body, of which 20% is ECF, extracellular fluid. Of that 5% is the plasma. This is what I was telling in the beginning. You cannot enter into the water, that is the intracellular fluid. Whatever you want to do, you can do only with this. This is otherwise your jugular vein or whatever cephalic vein. So through blood vessel only you can interact with the system. You cannot administer intramuscular, isn't it? So through the system. So 5% plasma. Why this is important? Why this is important? Please understand. This is 1/3 of whole, 1/3 of whole, and this is 1/4 of it. And to put it in a nutshell, this is 1/12. Why this is important? You calculate the total fluid deficit, and 1/12 is the plasma you can pump in. This is the immediate need. Why we are not bothered about this? This is the need you can pump in, okay, immediately. Over and above this 1/12 you cannot pump in because it is a vascular, it's a elasticity, isn't it? Up to that only it can accommodate. You cannot keep on blowing the balloon. Over and above that it will burst. So you calculate 1/12 and start administrating the fluid. So after that you have time. Okay, so if you calculate the fluid, we'll see it with an example. Calculate the fluid deficit, 1/12 is immediate. Aim at ECF. Your purpose or objective is to replace ECF. If you replace ECF, animal will start taking water or feed. If still it is not able to take, then you have to identify what is the cause. Maybe a lesion or ulcer or paralysis, that one. Okay, if you are aiming at ECF, second day visit is not needed. Okay, so we will see it with an example. The fluid deficit in liters, a percentage of deviation into body weight. Okay, this is the formula. Why we have been struggling with so many charts is to know what is this one, percentage of deviation. That's why you have seen the chart, skin test and CRT. Having known, so just substituting with an example, 360 kg body weight animal, 10% dehydrated. Known fact is 360 kg fluid deficit is percentage deviation in body weight. Based upon the availability, percentage is 10 divided by 100 and 360. So that is equal to 36 liters. On this cattle requires 36 liters. That is the deficit. Okay, now how we are going to do it? As substituting with the water distribution. Total deficit is 36 liters. One third is ECF, it is 12 liters. Okay, and then coming on to the plasma. Plasma is 1/4 of ECF, which is 3 liters. Or you can go plasma of total deficit, 1/12 is 3 liters. So in this animal, you pump in 3 liters immediately. And then 3 minus 12. ECF is 12, isn't it? Already we are given 3 liters, remaining is 9 liters. So our aim is to give 12 liters for this animal. We need not think of 36 liters. Aim is give 12 liters, then animal likelihood to become alright. Then how am I going to give the remaining one? You can give oral also. With the pump, you can give oral. So this is important. So substituting or the fluid distribution is more important. Calculate ECF, from the ECF 1/4 is plasma. So this compartmentalization is needed. Directly also you can do 1/12, give it, then what is easier, you can give it slowly. So this is a recap of this one. So plasma, you give it immediately. You can pump with whatever rapid fluid infusion set you give. If you have a pump also, you can give. Remaining you can give over a period, that is 9 liters, and remaining 24 liters. So this is a simple of fluid therapy. So very, very fast we have gone because we know the basics. Okay. So coming on the general, how the cattle, the fluid therapy or the deficit occurs is they are not over it, as in case of pediatrics. That's why pediatric is more important. Our calf or the sheep and goat kids are more important. The fluid distribution when you take it is 60-40, isn't it? In case of pediatric, it is 90%. Okay, so that is why you have to give due importance and calculate and recheck whether you have calculated correctly and then give it. And most important point is they are likely to be alkali. Alkalotic is more important, except in case of rumen acidosis and diarrhea. So mostly it is the alkalotic. So that is why it is very important. Then very often it combines with the chloride, potassium and calcium. So if you are taking care of these three important, potassium, chloride and calcium, and the majority you will success. And all the gastrointestinal disturbances is you have to focus on the alkalotic. Okay. Then comes on the oral and the GI tract, and even in human, the early return to oral is more important rather than the IV. They will attempt to give some kanji or gruel they will give, because the microbiota should not be lost and the villi should not be lost. So always keep the GI tract functional. So that is why returning to the enteral is more important. So that is whether it's a human or dog or cattle, and return to enteral is important. So also you should know how to give oral fluid therapy. Enteral route is the best, and the remaining part parenteral to replace what is being lost of plasma or ECF. Then oral fluid therapy, we have got different methods. This is the pump, and this is the accessory which you attach to the pump. And then this is the extension which you are a probang which go into the mouth. So through the bucket, 25 liters goes in 2 minutes, because each stroke it pumps in 350 ml. Just a stroke. So which you have missed during gym in the morning, that you can do it in the field. Okay, 10 strokes it goes inside. So that is a big pump which delivers 350 ml. This is a small pump which delivers you 100 ml per stroke. The advantage of the small pump is that you can attach it with the regular rumen intubation pump. That one may not be fixing with this. So this you can attach with the regular rumen intubation pump. So then what else you can give? ORS, like when we have a diarrhea, we give ORS for us, isn't it? Like that also we have got ORS. The standard is the sodium chloride, dextrose, water, mix it, and then this can be administered. This is normal ORS solutions or requirement. These are commercially also available. It is costly. Many companies are putting that. So this is one such company, and then putting on that you have to dilute it 1 liter and then give twice daily. So and more important again, if you notice, potassium also will come into the ORS. So rehydration therapy and potassium. First slide we have seen is the standard ORS, and this is another ORS which also can be given, where we have included potassium, calcium chloride, and propylene glycol. This animal is not taking feed for quite a long time. You can use this. The previous ORS is a standard ORS. Now today or yesterday it has not taken, you can give. This is prolonged anorexia. We are substituting the propylene glycol. And coming out to the impaction. Impaction, exclude the mechanical cause of intestinal obstruction. If it is normal, then you can give magnesium oxide, the excellent drug, magnesium oxide, 500 gram in 5 liters. Then needless to say, you have to correct the fluid therapy. Okay, needless to say, correct the fluid therapy through IV and push on this magnesium oxide 5 liters to your wonders, so it will pass the duct. This is for the cough. Again, the different materials, sodium chloride, potassium chloride as state, mix it 2 liters 3 to 4 times a day. That again depends upon the accommodation of the stomach. So this is for ORS in case of coughs. And this is, if you kindly see the percentage of dehydration. Percentage of dehydration. Okay, if it is very crucial, IV only has to be given. Okay, percentage of dehydration. Now coming on to the downer, this is more common. We get lot of cases of downer. Again, one of the important contributing factor for continuous recumbency is this one, potassium. So potassium is a must. So if you give potassium, you can give 180 gram to 200 gram. It is little bit bitter, but you have to give. You can give 3 times, sir. 3 days. It will become all right. A single dose. Which one, sir? 24 liters now we have put, no? Now. We have seen Roman pump, sir. Yeah, Roman pump only. Now if your aim is to administer only potassium chloride, dose is 180 to 200 gram. Then you can, with the electuary you can give. Now we are talking about fluid therapy, I put like this. Okay, if your aim is giving potassium chloride for a downer cow, you give 180 to 200 gram of potassium chloride with some electuary which makes it not so bitter and put it as a bolus. That solves the purpose. This is a fluid therapy we are talking about. So you mix it with 24 liters. Again, it needs fluids, isn't it? So that way we have covered. Any doubt? இது அந்த நிப்பிள் மாதிரி வரும் NS. இன்னொன்று வந்து இது ஒரு இது மாதிரி இருக்கும், அதில் சொருக்க முடியாது. நிப்பிள் மாதிரி வரதில் நிப்பிள் கட் பண்ணணும். ஃபுல்லாக கட் பண்ணக்கூடாது. ஃபுல்லாக கட் பண்ணி கீழே விழுந்துடும். அதுக்கு முன்னாடி இதை லைட்டாக வார்ம் வாட்டரில் போடணும். ஸோ தட் இது கொஞ்சம் லூஸ் ஆகிற மாதிரி இருக்கும். இல்லைன்னா நீங்கள் அப்படியே ட்ரை பண்ணிங்கன்னா உள்ளே போட முடியாது. ஓனருக்கு முன்னாடி கொஞ்சம் எம்பாரசிங்காக இருக்கும். அதனால் இதை வந்து கொஞ்சம் வார்ம் பண்ண கொஞ்சம் லூஸ் ஆகிடும். நிப்பிள் கட் பண்ணணும். ஏன்னா அது வழியாக தான் ஃப்ளூயிட் வரும். இதை நீங்கள் கனெக்ட் பண்ணிட்டீங்கன்னா இதோட ரேட் ஐ டோல்ட் யூ 45 to 90 செகண்ட்ஸில் 500 ml உள்ள போயிடும். It will efficiently does the purpose. To overcome the எங்ககிட்ட அந்த ஆர்டினரி சேச்சட் தாங்க இருக்குது, கவர்மெண்ட் கொடுக்குற சேச்சட். அதில் அந்த நிப்பிள் மாதிரி வர இல்லைன்னு இப்போ நவ் ஐ எம் புட்டிங்க அடாப்டர். ஏற்கனவே ஐவி செட்டு சொருவோம் இல்லையா, அந்த அடாப்டர் இட் இஸ் இப்போ தான் இது கொடுத்து டை கொடுத்துருக்கு. மேபி இட் வில் பி ரெடி வித் இன் 30 days. அது வந்துன்னா வில் ஆல்சோ கிவ். ஸோ தட் அது இதையே இருக்கிறவங்க அதை யூஸ் பண்ணிக்கலாம். இல்லைன்னா அந்த அடாப்டர் இதில் சொருவி அந்த பாட்டிலில் சொருவுன்னா சரியாயிடும். This we can use it for horse as well as the cattle or buffaloes. Sir, needle தான் உங்களுக்கு வந்து நான் சொன்னேன். Needle what is available with you can do. This is a 14 gauge needle. இது எவ்வளோ சாஃப்டாக இருக்குன்னு பாருங்கள். அப்படி குத்துனா உள்ள ஃபுல் லைட்டாக போகும். லைட்டாக இந்த பாருங்க இப்படி வச்சு இப்படி குத்துங்க சைன்னு உள்ள போயிடும். என்னென்னா அனிமல் ஆடிச்சுன்னா வெளில வந்துடும். அது போர் பெருசு, கொஞ்சம் ப்ளீடிங் அதிகமாகும். திஸ் கேன் பி யூஸ்ட், பட் திஸ் இஸ் இம்பார்ட்டன்ட். இது கிடைக்க மாட்டேன் இப்போ உங்களுக்கு நான் இதை சொல்கிறேன். நான் 14 gauge இது குத்துறதுக்குலாம் ஒன்றும் கஷ்டமே இருக்காது. ஐ லீவ் திஸ் சாம்பிள் டு யூ. 16 gauge போட்டிங்கன்னா ஃப்ளூயிட் ரேட்டு கம்மியாகிடும், போகிறது குறைஞ்சிடும். This is what I told you, catheter. இந்த நீடில் போட்டுறீங்க, அதுக்குள்ளே அந்த ஜே ஒயர் போடுறீங்க. திஸ் இது கத்தீட்டர். உள்ளே போட்டு இங்கே சுவிட்சர் போட்டுடலாம். 130 rupees. சார் நீடிலே தேவையில்லை சார். இது வந்து லாங் ரன்னில் வென்ஃப்ளான் போடுறோம்ல சார், நமக்கு குளுக்கோஸ் போகிற மாதிரி அந்த இன்ட்ரடியூஸ் பண்ணுறதுக்கு அந்த நீடில். அந்த நீடில் உள்ள ஒயர் போடுறோம். ஒயர் போட்டுட்டு நீடில் எடுத்துடுறோம். அதுக்கப்புறம் இந்த கத்தீட்டர் உள்ளே போடுறோம். ஓ ஓகே ஓகே சாரி. இந்த டெக்னிக் தயவுசெய்து கொஞ்சம் லிசன் பண்ணுங்க. இப்போ நீங்கள் பண்ணுற டெக்னிக் நீங்கள் பண்ணிட்டீங்கன்னா நீங்கள் தான் கார்டியோவாஸ்குலர் சர்ஜன். இந்த ப்ரொசீஜர் தான் ஃபீமோரல்லேருந்து போடுறாரு, 1.5 லட்சம் வாங்குறாரு. இதான் ப்ரொசீஜர் சார். இதான் ப்ரொசீஜர் வந்து ஃபஸ்ட்டு நீடில், அதுக்கப்புறம் ஒயர் போடுறாரு, நீடில் எடுத்துறாரு, டைலேட்டர் போகிறாரு, அதுக்கப்புறம் உள்ள கத்திட்டு போகுது, இப்படியே போய் அங்கே ஸ்டண்ட் வைக்கிறாரு. இவ்வளோதான். கொஞ்சம் கேத் லேப் வேணும், ஆனால் 1.5 லட்சம். அதனால் இந்த டெக்னிக்கு நீங்கள் கற்றுக்கிட்டு நீங்களும் இன்டர்வென்ஷனல் கார்டியாலஜிஸ்ட், இன்னிலேருந்து நீங்கள் எல்லாருமே இன்டர்வென்ஷனல் கார்டியாலஜி இந்த வெட்டினரி திஸ் வி ஹேவ் பீன் யூசிங் இன் டெக்கேட்ஸ். இது வந்து எப்போ வந்து ஃபீல்டில் பெர்குலேட் பண்ணி எல்லாரும் யூஸ் பண்ணுறாங்களோ அதான் சக்ஸஸ். அதுக்கு தான் வி ஹவ் பீன் ரிக்வெஸ்டிங் ப்ளீஸ் ஸ்டார்ட் யூஸிங் திஸ். இது காஸ்ட்டு இட்ஸ் ஒன்லி 130 rupees. ஜே-ஒயர் ஒரு 80 ரூபா, 200 ரூபாயில் முடிஞ்சிடுது. எவ்வளோ பண்ணுறோம், இது பண்ணோன்னா விட்டுட்டு நீங்கள் எடுத்து போயிடலாம் சார். ஒரு 2 டிஷ் வாஷை முடிச்சுட்டு ஒரு டீயை குடிச்சிட்டு குளிச்சுட்டு வந்து திருப்பி இந்த அனிமல் பார்க்கலாம் சார். All these are given to the people, so you can இது ஒன்று ஓப்பன் பண்ணி காமிச்சு. இது அந்த ஒயர் சார். இது it is available with the organizers. You can have a look. ஸோ அதனால் இன்னிலேருந்து என்ன பண்ணுறோம், ஃப்ளூயிட் தெரப்பி 4 பாட்டிலுக்கு மேலே இருந்ததுன்னா இது தயவுசெய்து போடுங்க. போட்டுட்டு மீதி வேலை பண்ணலாம். கையை கழுவலாம், சோப் போட்டு கழுவலாம் சார். ஏன்னா வீட்டில் போனோட குழந்தை வந்து ஹட் பண்ணும். இது இன்னொரு கத்திட்டு எக்ஸ்ட்ரா கத்திட்டு கொடுத்துரு. நல்லா வாஷ் பண்ணுவோம், சானிடைஸ் போடணும். ஃபஸ்ட்டு செல்ஃப் இஸ் மோர் இம்பார்ட்டன்ட். நம்மளை ப்ரொடெக்ட் பண்ணிப்போம், ஹெல்த்தியாக வச்சுப்போம், ஃபேமிலி ஹாப்பியாக வச்சுப்போம். ஸோ அந்த கழுவுற டைமெல்லாம் இதை யூஸ் பண்ணிக்கலாம். ப்ளீஸ் யூஸ் திஸ். தேங்க்யூ, குட் லக்.